Hello dear viewers, welcome back to my channel. Our topic for today is, can the skin act as a barometer? While the eyes are the mirror of the soul, the skin, which is the largest and most visible organ in the body, can give clues as to what may be ailing us internally. They may be varied, specific, and non-specific. Some of the most common manifestations that I encounter are, first, sandalasmata. These are indicative of hyperlipidemia or elevated cholesterol and serum triglycerides. They are flat yellow deposits around the eye, on the body. They're called xanthomata and may appear on the buttocks, the trunk, the limbs, the elbows, the knees, hands, and over the Achilles tendon. Second is jaundice. It's indicative of liver disease wherein the skin and eye sclerae turn yellow. There can also be concomitant redness of the palms, spider vein nevi, especially on the chest, and generalized itching. Third are protruding rubber ball-like lesions under the skin, which may be brown, pink, or skin color. There are also dome-shaped lesions on the body that may be soft or firm to touch, and brown pigmentations in the eyes. Often, they appear during puberty and adulthood. Such lesions are indicative of neurofibromatosis. These nodules are usually benign, but sometimes can become cancerous. However, since these tumors originate from Schwann cells, which protect your nerve cells, spinal cord schwannomas may develop and cause paralysis. Other complications that may appear with it are hearing loss, cardiovascular problems, loss of vision, and pain. Next is chronic paritis. This is itchiness that has been present for 6 weeks or more, causing the patient to do repeated scratching, causing bleeding and infection of the areas involved. It may also manifest as redness, scratch marks, bumps, blisters, and leathery or scaly patches. It is more common in older adults as the skin tends to become drier with age. Some underlying causes can be 1. Eczema, 2nd psoriasis, 3rd scabies, 4th parasites, 5th insect bites, 6th liver disease, 7. kidney disease, diabetes, thyroid problems, multiple myeloma or lymphoma, nerve disorders like multiple sclerosis, pinched nerves, and shingles. Psychiatric conditions like anxiety, depression, and obsessive-compulsive disorders can also cause it. There may also be concomitant as well as actual irritation and allergic reaction to certain substances. Next is we have this bluish bulbous fingernails caused by a low level or lack of oxygen in your red blood cells. They can be indicative of liver, lungs, inflammatory bowel disease, AIDS, and heart problems. Patients with severe liver disease present with nails that are entirely white with a small band, pink or brown at the tip, called Gary's nails. And for kidney disease, nails can be half white and half dark, and these are called Lindsay nails. Other nail conditions that do need medical attention are discoloration, changes in nail shape, thickness, brittleness, pitting, and bleeding, as well as swelling, pain, and separation of the nails from the skin. Next, we have non-healing wounds, which are usually associated with diabetes, anemia, cancer, high blood pressure, heart disease, or varicose veins. Then we have multiple seborrheic keratosis, which are brown, black, or light tan, common skin growths that may increase in number as one gets older. Although considered benign, it is essential to be able to differentiate these lesions from malignant tumors. Then we have skin thickening and pigmentations, mostly in the axilla and the nape, giving the skin a leathery appearance, which is usually a manifestation of impaired glucose tolerance that may also reflect internal cancer. Then we have the striae, or the moon phases, and the skin fragility, which may be indicative of Cushing's syndrome. Then we have the concentric red lesions resembling wood grain, or the erythema gyratoum, which has been associated with various cancers. Then we have dermatomyositis, which is a rare inflammatory disease marked by muscle weakness and distinct skin rash. An increased risk of breast, lung, ovarian, and gastrointestinal tract cancers for patients 40 years to early 60s. In children, it most often appears between 5 to 15 years of age. Next, we have the Tele-Injectation, which are thread-like red lines or patterns on the skin, which form gradually and often in clusters. We commonly call them spider veins because of their web-like appearance. Although usually benign, they can also be a sign of serious illness of the liver secondary to alcoholism. Then we have the butterfly blush or the non-descriptive erythematous maculopapular eruptions. This is also accompanied by photosensitivity, alopecia, subcutaneous nodules, leg ulcers, and gangrene. All of these are indicative of systemic lupus erythematosus. which is an autoimmune disease with multi-organ involvement, wherein the skin is the second most commonly affected organ. And then we also have these bumpy red patches with silvery white scaly rashes, which can grow anywhere but mostly appear on the scalp, the elbows, the knees, and the lower back. Psoriasis being an immune system disorder, it causes white blood cells to become overactive and produce chemicals that trigger inflammation in the skin, which can also affect other parts of the body, including the lungs, the heart, and it may also cause cancer and arthritis. Then we have the simple moles, which are a very common type of skin growth, which I have personally, which appear as small dark brown spots caused by a cluster of pigmented cells. Be alarmed if your mole is a changing mole that has smudgy, irregular edges with an even color that just appeared in adulthood. Mine appeared when I was still a child. So as you have noticed, the skin can really be a barometer of what is happening in your internal system. Hence, if you notice any skin abnormality, it is best to consult immediately to know that cause. Always remember that an ounce of prevention is always better than a pound of cure. I hope that you find what I just shared to be helpful. Greetings to John and Christine Santos, the two of my favorite patients. Please do subscribe, like, and share, and don't forget to click the bell button to get notified. You may also send me your comments on the comment section below. Till next time, God bless you, stay safe, healthy, and of course, beautiful.